Hi everyone, so it's Dr. Owen McDonald here again. It's the evening of Thursday, the 26th of March, and I just want to quickly check in with you, tell you how we're going, and hopefully see how you're all going. Just a quick update here on some figures. You can see on the chart here that as of this evening, there is 2,774 cases in Australia. So at the moment, the number of cases is doubling about every 3 to 4 days. So across Australia, in WA, we have 205 cases, still quite low. There are confirmed cases, and obviously New South Wales is the hardest hit at the moment due to mostly inbound travellers, patients off cruise ships, etc. Obviously, we're all hearing about social distancing, washing our hands, really basic stuff, and that is the most important thing to consider. Really, it's the only way we're going to stop the spread of this virus, by not touching each other and not leaving any traces of virus behind us. I want to show you this simulation. This was done on the Washington Post website. Um, this is if people do not socially isolate. And what you can see is as each person touches someone else, all the little blue dots turn to brown dots. So this is the infections and new infections over time. You can see the brown curve rapidly rises. So more and more people get sick very quickly because we're coming into contact with each other and very quickly getting infected. And what happens is the health system gets overloaded. On the other hand, if you put containment measures in place, so if people socially distance, which is determined by these blocks here, lots of people stay at home, only a few people go out, and the rate of new infections is much slower. So you can see on the brown curve here that the rate of rise is much slower compared to the previous one, and that means people still get infected but much more slowly. So what happens is that the healthcare system can actually cope over time. Now the reason we are worried about that is because if people get seriously ill, there is only a certain number of ICU beds in Australia. So in WA, at the time this was published, this stated that there was only 162 ICU beds in the whole of Australia. They obviously are rapidly trying to increase the number of those beds, but there still is not enough for the population if too many of us get sick all at once. The reason this is important is that there is a critical number that we will reach where all of our ICU beds will become full of patients with coronavirus. So the rough number that they have mapped out is that in Australia, if 45,000 people need hospitalization with coronavirus, 5% of those will be critical and need ICU beds. So based on those numbers, this red line here is the critical capacity of our ICU beds. So if the number of corona cases keeps rising along this graph, unless we can actually slow it down, what will happen is around the 7th to the 9th of April, the number of ICU beds will be critically full, and beyond this point the system will not be able to cope. So when you hear about people talking about the flattening of the curve, and what they're trying to do is slow that rate of rising down so that the number of really sick people gets spread out over time, and as some people get sick, other people improve, can be discharged from ICU to make room for the next wave of people. So it's a really important concept, and that is why we are socially distancing ourselves, washing our hands, and try not to spread the virus as much as we can. So that's why we made a decision very early on in the practice to change predominantly to telehealth. As I said before in previous videos, we will bring people into the practice if we need to, obviously gowned up in full protective equipment to try and limit the spread of virus. The problem is we just don't know how much is out there in the community because there is very strict criteria for testing. So we basically have to presume that there is a lot of it out there. Thankfully, the government has now broadened the Medicare criteria. So from Monday, everybody will be eligible for telehealth consultations. We made that jump early as a practice. We basically were ringing everybody, making a service available to everyone, and a lot of doctors have pushed for it. And thankfully, the government have listened to us. And now from Monday, there will be telehealth items for normal consultations and mental health consultations as well, which is really important because we as doctors and health professionals understand how stressful this whole situation is for everyone, and we want to be able to help you with that. So as I said before, the most important thing you can do is to remain calm, practice social distancing, wash your hands, and stay away from people as much as you can. I mean, at the moment, while it is inconvenient and it is affecting us and all our lives in a major way, things like bread shortages, pasta shortages, toilet roll shortages, it might seem like an inconvenience, but in a couple of weeks or months time, those same sort of inconveniences could actually become a reality with ICU and ventilators. So while you think a lack of toilet roll might be inconvenient, if we don't practice social distancing and the number of cases gets much worse, the ICUs will fill up with people with coronavirus and severe infections. And if people do present to a hospital, there won't be a ventilator available for them. So difficult choices will have to be made. So at the moment, as I said, it might seem inconvenient to not have toilet roll or pasta, etc. But if we don't take this thing seriously, there won't be ventilators for all the people who need them. So as I said, the biggest thing we can do is stay at home, wash our hands, and if you need us, we are here. We are all here in the practice. We are available. All you need to do is make a telephone consultation appointment. We are rapidly trying to develop our ability to have video so you can see us and we can see you. But again, that is a work in progress. So thank you very much for your understanding. Please just do the basics, stay at home, social distance and wash your hands. And that is the best thing you can do. Okay, take care and I'll talk to you soon.